This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. The next possibility is that the pregnancy carries on. So it is the pregnancy, although it's not viable, because the hormone levels don't drop because the placenta is still producing those hormones. At that point, we have two options. The first is to use some medical tablets to make the uterus contract to try and expel the pregnancy. It is probably the simplest way of doing it. It's not 100% successful. The second option is to do what's called a curette. So we put you to sleep, dilate up the neck of the womb, and then with a suction catheter, scrape out the placenta and the embryo, and that's the end of it. So many couples elect for getting it all over and done with, i.e. have a D&C. Others elect to have the medical treatment, which takes 2 or 3 days, and as I say, in about 5 to 10%, they end up having the D&C anyway. So that's what happens. I mean, obviously the third option, which is what I started with, is that nature will take its course at some point, and if you're very patient, don't want a procedure, don't want to take tablets, we can just sit and wait and let nature take its course. But that may take 2, 3, 4 weeks. So the treatment of miscarriage then is what I've just described. Once the pregnancy has been expelled, many couples ask me, how soon can I try to get pregnant again? Now, the evidence is very marginal. In other words, there's not a lot of evidence. But I certainly say wait for, you're going to have a bleed, obviously, with the expulsion of the pregnancy. Wait for the next period, but after that, go for it. Now, I know there are old wives' tales and some old-fashioned gynecologists who will tell you to wait 3 months. There's absolutely no evidence that you need to wait. Get on with it. It does not make any difference to the chances of a miscarriage in the future. So it is a bad event. I mean, I've had patients who've had a miscarriage who previously had a bad outcome with a pregnancy, who said, and that was late in pregnancy where they lost a baby. And they said the miscarriage was as bad as the stillbirth. I mean, that's how bad it can be for some people. Because unfortunately in the 21st century, this is coming from an old boy who mostly lived in the 20th century, I've seen things change. The expectation is that we plan our pregnancies, whereas in my parents' days, there wasn't contraception. And so you couldn't plan. You actually got married and then you had a baby, or you had a miscarriage, and then if you had a miscarriage, you get on and have another baby or keep trying at the age of 23, 24, 25. Today, we're all waiting, or people are waiting till they're 30, 32, 35. Once their careers are sorted out, they've got their nice car, they've got their mortgage sorted out, and then they'll go for pregnancy. It's a very planned event. So when the plan goes wrong, it is a devastating experience for many people. But my message is that you need to be optimistic. Nature is a bastard, there's no question, but the subsequent pregnancy is highly likely, 85% likely, to be absolutely normal. So go away with that message in your head. Having had a miscarriage, the world is not the end of the world. You will have a baby. At least you can get pregnant. That's number one. As a fertility specialist, that's a plus for me. And then going on, I've been very positive about your chances of an ongoing pregnancy.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.